Right, let's discuss this further now with Professor Mosa Moshabela from the University of KwaZulu-Natal. Thank you very much, Prof, for your time. Now, obviously, it seems this Sapra briefing was more about clarifying to South Africans exactly what their mandate is without having allegations that are going against them at the moment.
Yeah, good day to you, Masego, and to the viewers. Absolutely. I think that it's really unfortunate that Sapra is finding itself in this situation where it has to defend its mandate. However, I also think that it's a good thing. You know, Sapra has become, in the past year and a half, a very important entity in the ecosystem of how we respond to COVID-19 in this country. And it plays a major role also in terms of how regulatory structures are understood in Africa. And I think citizens have every right to ask questions, to say exactly what is Sapra doing and where they feel that they are not satisfied, to ask questions. However, I think that there needs to be an understanding of the context within which Sapra operates and the legislation that Sapra operate under.
Yeah, and Prof, I think what's important is what they announced today, saying that they've reduced the time that they'd usually spend on, approving a new medicine into the country from about 20 months to less than 3 months. Obviously, with the vaccine and with our numbers increasing here in South Africa in terms of COVID-19, this has compelled them to do that. But is this a good thing?
Yeah, it's a very good question. And I think that it's a similar question that we've been asking around the manufacturing of vaccines, for example, in terms of why is it that we are reducing them from 5 to 10 years in terms of their development to about 18 months to 2 years. But I think that they have also indicated that they are considering this under sort of a state of emergency use. And that is a particular kind of approach that, of course, given the pressure on the country and the challenges that we face and the public health emergency that we are under, there is a requirement for them to put everything aside and basically focus on the applications that are meant to provide us with interventions in the short term. So on the one hand, it is a very positive thing. But on the other hand, I think that there is a risk in the sense that it will strain their resources to go through the necessary review processes, because they cannot compromise any step in doing that. And they go through many steps. And in all of that, they still need to make sure that they protect the safety of South Africans and all the citizens. They need to make sure that there's quality in the medicines and the processes that have been followed, and the efficacy of these products it can be assured relevant to this context in South Africa. So they cannot compromise any steps, but they need to make sure that they garner all their resources in order to make sure that they complete all the steps in this shortened period of review. And this is an international phenomenon. It's a global phenomenon. It's not something that is unique to South Africa only, and it's necessary under the circumstances.
Now, Prof, we do know that, we have this new Delta variant that's driving the high numbers, especially here in Gauteng, and we have these new vaccines that have applied to be distributed here in South Africa, one of them being Sinovac. Do we know anything yet about the efficacy there for South Africa between Sinovac and the reviewing of the Sputnik vaccine as well?
Masego, not to my knowledge in terms of the variants of concern that are prevalent here. And I think this is probably one of the contentious issues in the consideration of the data that has been submitted to Sapra for review. But if Sapra is saying that they are at an advanced stage, I'm assuming that there's some form of data that they may have received from the people that have submitted the Sinovac vaccine. So I'm not aware that we have seen any conclusive data in terms of the beta variant or the Delta variant regards to Sinovac. In fact, the data that we have, that is real-world data, which is as opposed to efficacy, which is done under clinical trial conditions, and now we are talking about effectiveness, which is seen under real-world situation. It does not look good in terms of Sinopharm. It's got an efficacy of about 50% in countries where it's been implemented. Of course, some have claimed higher, but on the whole, the average is really kind of midpoint. And even though it just about makes it for the requirement for the WHO, we've seen that there's been a lot of breakthrough infections where it's been used, and now with Delta, the numbers are going up. However, what we are waiting to see is whether hospitalization and mortality have been reduced in those countries. So, for example, in the UK, they use Oxford AstraZeneca vaccine and Pfizer a lot. And even though with Delta their numbers have gone up, we are seeing that there is still low hospitalization and low mortality. And amongst those who are hospitalized, most of them are the ones that did not take vaccines. So Sinovac has to be able to demonstrate that it's also able to do that. Even though, for example, we might end up with some breakthrough infections, as we are seeing in other parts of the world, there still needs to be assurance that it will protect in terms of hospitalization and death with regards to this particular variants of concern that we are dealing with. Other vaccines have demonstrated us. It's one of the reasons why we did not have demonstrated that to us in South Africa. Is one of the reasons why we had left AstraZeneca Oxford vaccine behind, because it did not perform well with the data that we had against the beta variant that is dominant here. So all of these considerations, Marcel, are really important for Sapra and the different reviewers involved in these processes to ensure at the end of the day, if anything goes wrong, we will hold them accountable from that perspective. Whether they gave in to political pressure or other kinds of pressure, we would want to make sure that they can provide the evidence that these things have been considered. That's their job.
And of course, Prof, it's very important, we assume, to have more vaccines. The more, the better. But also, are we talking anything about the kinds of treatment that we're going to have? Because we still have people who do get very sick even after getting the vaccine. I think people don't understand that even though you're vaccinated, you can still get COVID. But are we having any conversation about the treatment even after being vaccinated?
Yes, Masoro, I think if you look historically, I mean, we've been through wave 1 and wave 2, and throughout we've always mentioned that we don't really have good treatments. There's been many drugs and treatment modalities that have been tried that can, for their effectiveness in terms of treating COVID once someone has disease, has infection and disease. And, the only things really that have been demonstrated to be effective is, some sort of hydrocortisone, some form of steroids that can be used to reduce inflammation. And largely, for the most part, oxygen. It makes sense because this is a virus. And in general, most viruses are not necessarily responsive to actual treatment. They respond better to vaccines prevention. And as you correctly say, that with vaccines, given the variants that we have, we realize that, they keep evolving, and we have changed our threshold to say, instead of just looking at herd immunity, but to say, can we primarily protect people from severe disease and death? And we need to make sure that we can provide the treatment for that. And it's still the mainstay of it going to be largely providing oxygen, giving some relief, giving some supportive treatment. But we don't necessarily have a cure, and we don't expect to have a cure for COVID-19. We have to rely a lot more on the prevention, which is why anyone who has been in doubt, for example, on the fence about whether they're going to take the vaccine or not, the arrival of the Delta variant should be a compelling reason for why everyone who can and is able should take the vaccine, and take the vaccine as soon as possible. And this is the only way we can really make sure that at least even if people are infected, the blow is going to be minimal. And we are seeing that evidence in from other parts of the world, and we would like to get there as well.
All right. Thank you very much for your time. Professor Mosa Moshabela from UKZN, always a pleasure.